What's up, beautiful people? Another day, another study. Insomnia is a common reason why people seek out primary care physicians. And we've talked about exercise as a treatment modality for insomnia before. And we've talked about cognitive behavioral therapy for insomnia before. This study was a network meta-analysis, which is a type of meta-analysis which tries to compare the results of different interventions to weight their relative efficacy. So this study had 22 randomized controlled trials with 13 distinct interventions, 7 exercise versus 6 non-exercise controls. And I put the specifics down below. Certain interventions seem to be a little bit better when you used a certain questionnaire, or if you used sleep diary measurements versus objective measurements. At the end of the day, does this change what I recommend for insomnia by the way of exercise or cognitive behavioral therapy? No. And I usually take all my recommendations in the total context of what's going on with the patient. Of course, if someone isn't doing any aerobic exercise or strength training, I'm going to recommend both of those modalities for cardiovascular health, for metabolic health, for brain health, all of the benefits we've talked about on the channel about routine aerobic exercise and routine strength training. Now, if someone is dealing with some mental health issues, maybe it's anxiety, depression, adding in some form of mind-body medicine is a great recommendation, whether that's yoga or Tai Chi. Both of those interventions were included in this meta-analysis showing efficacy for improving parameters of sleep. And then if someone is looking for another intervention, maybe I'll suggest cognitive behavioral therapy first line. You can go to CBTi directory. That's an online directory of cognitive behavioral therapy practitioners, or you can use an app. There are some that are prescription only, but CBTi Coach is one that's pretty popular, has, I believe, 3 randomized controlled trials supporting it, maybe more now. But these are all recommendations and interventions that I've recommended for insomnia. But I will take into account, like I mentioned before, the total health of the patient when making these recommendations on where to start. So if someone is at risk for cardiovascular disease, aerobic and strength training may be where I start. And if they need a little bit more support, maybe mind-body medicine or cognitive behavioral therapy. Or in a patient-centric approach, you ask them, which one of these are you most likely to start doing tomorrow? And then you start there and then you add on. And that's how I tend to approach any suggestion or recommendation with patients.